I've been so wrapped up in what I wanted to talk about with these notes of some really interesting stuff that my last minute prep isn't up to par. All right, two of the main things as I've titled the uh, stream: hormones in your food and calming that heart fibrillation. I can't leave the heart alone. I talk about the heart every week. More and more. And another person just succumbed, somebody else I know, just in their 50s, just succumbed to a heart attack. Completely unnecessary, does not have to happen. There are things that can be done to prevent that. Primarily our lifestyle. It's our lifestyle that leads to these things. How do I know that? Because 150 years ago, we didn't have heart attacks. We didn't have heart disease. Heart problems weren't even discussed with the CDC. Didn't show up in any of the categories, in no census reports, no nothing. Ever talked about heart disease. From 1910 on, and I will get to what happened in 1910, large scale across the country, then you started seeing heart disease. So I will get to that here before too long. And then also, hormones in our food. Again, I was asked a question about this. The pig slop, I don't know what else to call it. The pig slop that a lot of Americans choose as their daily food. I'm not so sure anymore that actually that pigs would eat it, because the chemicals in our food. This is one of the things Bobby Kennedy Jr. is trying to clean up. His problem is a lot of the members of of our Congress that make our laws are owned by the food corporations. They're owned by Big Pharma. They're owned by the military complex. They do not represent us. They represent their donors. And so when you have a hero like Bobby Kennedy Jr., who's trying to clean up the food because he knows where all the chemicals in our food leads to, the disease processes, the degenerative diseases, the continued rise of cancer, of high blood pressure, of heart disease, of congenital abnormalities, infertility, immunosuppressive problems. You know that Americans consume more chemicals in our food than any other nation. And at the same time, we consume more chemicals in our food, which chemicals, the bitterness of these chemicals is covered up by artificial flavors that are put into the food. Artificial flavors aren't just there to make that artificial banana cream taste like banana cream. The artificial flavors making you think that's banana cream pie you're eating is in there to cover up the chemicals that give you the artificial banana cream taste. What a racket. What a racket. And so at the same time, Americans are consuming more chemicals in what they get from the grocery store, from fast food, wherever else, except maybe the backyard garden or the farmer's market. Is at the same time we have the gloomiest predictions for the future of health in this country, with heart disease continuing to rise, high blood pressure, cancer. I shouldn't even mention high blood pressure. I don't think it's that big of a deal. But especially infertility. So our country leads the civilized world in, at the same time, chemicalized food and degenerative diseases. We also lead the world in the highest living standards. And we also lead the world in the most abundant food. So both of these should reduce instead of increase the degenerative diseases. And the only possible explanation of the United States more than equally sharing with the civilized world the rise in these diseases is that our food, although most abundant, is also the most unwholesome. Two records at once: more food than anywhere else, and the worst food than anywhere else. So Americans, though just absolutely hypochondriacal, is that a word, about cleanliness of our food, are simultaneously very strangely ignorant about what's in it. Yet there are more, what the things that I'm talking about, the chemicals in our food, are far more dangerous than any dirt or bacteria that's likely to contaminate the food. So from time to time, you hear this report on how a bag of strawberries is causing listeria, or some spinach has got E. coli. E. coli does not grow on spinach. Listeria does not grow on strawberries. It ended up because of the food handlers. Somebody just wasn't all that clean after they went to the bathroom before they touched your pre-bagged salad material that's there in the salad section of the supermarket, waiting for you to get it. Well, I am recording. Well, thank you, Paul. How do I get into that so I know when to stop it? 0, 16, 40, boom, boom, boom. Well, it looks like maybe it started all over again. Just because I got in there. All right, I'm not going to worry about it. So, the last point I'm making there, what has been put into this food to make you think it's food is far more dangerous than any E. coli or listeria or whatever else that might show up, where you end up seeing some field in the Imperial Valley or the San Joaquin being closed down till they clean up whatever happened. And it's just the workers out there that aren't practicing, in most cases, the workers that are not practicing good hygienic habits. Now, the Food and Drug Administration makes great efforts, they really do, to a large degree to protect the public. But as an individual, there's very little active support when it comes down to one person after another person. But there's even less active support from the citizens themselves. I think if there were more understanding of how chemicalized food is and how it's insidiously eroding away the health of the average American, even faster than we see in Europe, I think then more and better legislation will not only be tolerated, but demanded. Instead, for instance, we get these protests being made about cranberries being sprayed by aminotriazole, being condemned. And I think the public would be delighted at being guarded against a cancer risk, but it's always too little all the time. Better legislation, I think, would lead to all the world in a greater similar protection of health. Paul, are we recording? I can't tell if I am or not. Now, one of the worst, most common, ubiquitous sources of poisoning in America is the commercial flour and the bread that comes from it. I've talked about this so many times, I think I could write a book on it. But I'm going to do it again in answer to a listener's request. What's the best bread to buy, is what they said. The keeping of quality of flour is the last and most important problem confronting the millers, those who mill the wheat into flour. And what are they going to deal with? How are they going to deal with the dullness of the flour from bleaching it in order to preserve it, if the flour still goes sour and ends up breeding weevils. The great problem of all staple foods, whether it's meat, fish, milk, butter, is that they go bad. They have to go bad because for what is good for us food-wise is also good for the microbes and the weevils. I mean, one proof that food is nutritious is that it can support other forms of life other than man, as opposed to getting a bag of a particular kind of chip, not just potato chips, but the other kind of, the corn chips and all these things, and you put an ample amount of it in a cereal bowl and put it on top of the refrigerator and watch what happens to it. And you'll notice after the weeks, after the months, the only thing that happens to it is it becomes a dust collector. But nothing happens. Nothing grows on it. Even the bugs won't eat it because it's not food. Yet we just gorge ourselves on this stuff all the time. Now, food which cannot go bad is bad food. I don't want to sound condescending. I'm trying to make this as simple as I can, in the simplest of terms, so you can explain this to your children. Food that won't go bad is bad food. Food that won't spoil has no business going inside your mouth and down your throat. And the parts of food that spoils the quickest is the most nutritious part of the food. Flour, on the other hand, never goes bad. I have a bag of white flour in my pantry. I think it's maybe a 5-pound bag. And it's got a little clamp on top of it to keep it closed. And I bought it 3 years ago to make some gravy. I was trying to make some gravy the way my grandmother did. A beef gravy made with drippings from a roast. And the gravy always was more delicious than the roast. And so I bought something I almost never buy, a bag of flour. And I checked it just before I got here to do this program. And it's still sitting there looking like it did 3 years ago when I opened up that bag. Because flour never goes bad. It has rid itself of the original sin of all staple foods in that it won't go bad. And by the most miraculous of all miracles, the very chemicals which are supposed to, the chemicals that age and bleach flour also make it sterile. It makes the sterility, the purity of bleached flour so clean as to make it as safe as to leave it laying around as a eunuch in a harem. Now, there's something they used to use called agene, A-G-E-N-E. It was nitrogen trichloride. And it was the first, or at least the most widely used chemical in flour. This is back before I was born. But in 1946, it was shown that flour that was improved, in quotes now, new and improved, in quotes, caused epilepsy in dogs. Flour that was sterilized by agene, and they sterilize it to keep out the weevils, to keep out the molds, and to keep out the weevils. I mean, to this day, in a flour mill, you won't find weevils in the bags of white flour. And you think, well, that's good, that's great. No. The sterilization of that flour by this one product was causing epilepsy in dogs, seizures. Now, man, as far as can be shown by rather brief, rather scant, not too terribly complex experiments, does not develop seizures when eating the amount he could absorb from the bread. So agene was considered safe, and it is continued use until 1956, when it was replaced by what they use now currently, chlorine dioxide. And chlorine I don't know if I don't want to put in the punchline too early, but I'm going to. Chlorine dioxide is one of the quickest ways to diabetes. Chlorine dioxide kills the beta cells of the pancreas. And it doesn't take much chlorine dioxide to do that. If you don't have diabetes and you would like to have diabetes, you want to add copious amounts of white bread, commercial white bread, to your diet. But they also found, and I think it's instructive to note, that all the research on the safety of that agenized flour for man centered around the possible production of seizures and the exacerbation of epilepsy. While it was not until the agene was no longer used that it was realized that the agene was also causing myopia or short-sightedness in children. Now, the chlorine dioxide of today is just as miraculous as the agene was from a commercial point of view. But it's as harmful from the point of view of the consumer. It bleaches flour. It ages or improves, in quotes, improves flour, new and improved. But it also sterilizes the flour. Now, this sterilization is the center point of the whole fight between the millers and good health. Untreated, 82% extraction stone ground flour will go sour. It will breed insects if it's carelessly stored or stored for too long. Untreated means unbleached. 82% extraction, which means there's some bran and germ in there. Of stone ground, not the steel ground, but stone ground, and there's a difference, will go sour and it will breed insects when it's carelessly stored or it's on the shelf for too long. And the sourness and the capacity to support insect life is largely due to the oil that's in the flour. Now, this oil occurs only in the germ of the wheat berry. And most of the germ, they've gotten rid of it with these steel rollers instead of the stone, which have supplanted most of the steel millstones. You have to look around far and wide to find a milling outfit that still uses stone rollers. But these rollers crush the wheat instead of grinding it. The steel ones do. So in the old days, back before I was born, well, even up into the 60s and 70s, the wheat berries would come in from the wheat farmers, and the millers would run that stuff through their stone grinders, and it would bust open the germ that released the oil into the mix. Well, what are they going to do about it when this happens? Well, these rollers that they have now crush the wheat instead of grinding it. And while the brittle little starchy part of the wheat breaks up into powder, the soft germ, instead of being broken open, is just squeezed into flakes. And when they're squeezed into flakes, they're very easily removed through the sieves that they use to run the flour through to get these little flakes out, so that it's white and not wheat, whole wheat flour. Well, so far so good. A flour has been produced which is much less prone to going bad. Why? Because the first thing to go bad is the germ. What's so special about the germ? Well, that's where the essential fatty acids are. That's where the vitamin B family is. That's where vitamin E is. That's where the minerals are, and the essential amino acids in the germ of the wheat berry. But in the modern milling process they have now, that germ ends up getting flattened out into flakes. Instead of being ripped apart with stone rollers, the steel rollers now just flatten it, and then they just run it through screens, through sieves, to get all that stuff out of there, so that you have this perfect white flour left that is essentially a non-food at this point, except there's still enough life in it that it can go bad and breed insects until they put in the chlorine dioxide to finish off the murder of that flour. I don't know what else to call it. Now, chlorine dioxide doesn't have the bitter taste that old nitrogen trichloride did. That was another reason why they had to get rid of that. What does chlorine dioxide do? Well, it destroys all the remaining vitamin E that's in the flour. It destroys or forms a toxic product, or a perverted one, with the oil's essential fatty acids, and it destroys or may form a toxic product with one of the important amino acids, methionine. And to this graveyard of nutrients, there's this lingering miasma of chlorine dioxide, and the millers have achieved a flour that is as nearly non-nutritious as possible, and as covertly, as insidiously corrupting to the human body as food can be. And what are you going to do about it? Are you going to feed bread to your family? Then mom or dad, whoever makes the bread, has to make the family bread from untreated, stone ground flour from small mills. And we have them here in Utah. Untreated means that chlorine dioxide, an insidious poison, has not been introduced to finish off, as I said, the murder of that flour, of that wheat product. So here we have an extremely nutritious food, heritage wheat. And if you take it and you grind it and you bake bread out of it within the first few days of the grinding, you're going to have a nutritious food. The vitamin E will be there, the vitamin B will be there, the essential fatty acids, the minerals that came from the soil in which that wheat grew will be there. And you actually have a product fit for your kitchen, or your dinner table for your children. But they lose money. The millers lose money when they make this kind of flour, because if it isn't all purchased within the week of the grinding, insects are going to show up. And interestingly enough, as insidious as this pestilence may be, mealworms and the bugs and everything else, they are a sign that there is life in what they're eating. It's like the test when someone asks me, well, what's the difference between the vitamins you push from standard process? and the ones they're getting from the health food store. But I said, it's really simple. You put about a half a dozen of the little tiny tablets from Standard Process in one hand, and a half a dozen of your superpower hydronuclear fueled vitamin B complex in the other hand, and put them in front of your dog. Let your dog smell them and see which one the dog eats. It's very simple. Now, that's the long answer to a question I was asked about white flour and wheat flour by a person old enough to know the difference. Because they would say, well, the flour's enriched. Yeah, the flour's enriched with synthetic vitamins. They take the richness out of the wheat, and then they end up with this dead white stuff that makes great tasting bread, mind you, and makes good gravy, thickening. But there's no life in it. So in order to get around the food laws, they can't just say, hey, this white flour, while it has no bugs in it, it also has no life in it. So what they do is they enrich it. They spray it with synthetic vitamins. Now it's enriched. Now just think of that. Just think of that contradiction. Enriching something that nature made. No, that's not true. You're not enriching something that nature made. You're enriching something that man destroyed that nature made. And now to try to get across the idea that it's commercially acceptable to your dinner table, they have to enrich it. Now, along with that, I think I beat that horse. I want to talk about the carcinogens that are in the food besides the enrichment of dead flour. I mean, it would seem essential because I was just talking to a woman last night with endometrial cancer. And she's under the care of an oncologist and a gynecologist. And she knows that I do not treat cancer. We don't treat cancer in our office. We don't treat heart disease. In fact, we treat very little. What we do is two things. Number one, open the nervous system back up so it works correctly. And number two, offer nutritional support for people who have problems and for people who don't have problems. And we offer nutritional support for people who have cancer, as well as offering nutritional support to people who don't have cancer. Now, with that said, and talking to this lady last night with endometrial cancer, and she has been bleeding for 2 years. And she's out of state. She has been doing everything she can of a natural way. And so I spent half the conversation last night on something that we believe will arrest the bleeding, but also helping her to get over the fear of hysterectomy because she's scared they'll take her ovaries as well. And I said, well, not if you demand they don't. And if your ovaries are loaded with cancer, you want them out of there. You'll just have to do HRT. But if there's a lot of gynecologists, oncologists who understand very clearly, you don't remove a woman's ovaries unless it's absolutely essential. So her doctor told her, well, you don't need them anyway. So, you're postmenopausal. You don't need those things anymore. And I said, any doctor who will tell you you don't need your ovaries past menopause, you are in the wrong office. Either they missed the lecture on postmenopausal hormonal supply to a woman moving into the golden days of grandmotherhood, definitely in need of her ovaries. Or they're idiots. And there's enough idiots in the healthcare business, let alone in medicine. So I said, I tried to talk her down off the ceiling. I didn't tell her she needed the surgery. I said, that's between you and your surgeon. But they have that intravaginal extraction of the uterus type of surgery today. It's so easy. Well, it's probably not the right word. It is so slick and so clean with very little side effects that if they say this is true endometrial cancer and it's the metastatic form, you want it out of there, and you want it out of there now because it's too far gone. The help that I could have and Trudy could have given to you, you needed 2 years ago. It's a little late. Now, I gave you that story to tell you this. It would seem essential. I think any reasonable woman would understand she needs no external source of estrogens that would be given to her if she's under treatment for cancer of the breast, or to any woman, cancer or not. But commercial beef, commercial lamb, especially poultry, is increasingly contaminated with artificial estrogens, which have been injected into the animals in order to fatten them up and to increase their rate of growth. Estrogen makes things grow, just like testosterone does. And the areas of the body that estrogen stimulates growth in for a young girl, or the areas of the body that testosterone stimulates growth in a little boy's body as they get older, is based on receptor sites for those hormones. A receptor site is like a catcher's mitt. And what's it catching? Well, it's catching the pitch from the pitcher out on the pitching mound. And that pitch might be a neurotransmitter. It might be an enzyme. It might be some chemical messenger. But it might be a hormone. And when that hormone fits inside that catcher's mitt, just like a 95-mile-an-hour baseball does in a catcher's mitt, so will receptor sites for estrogen in the human body grow when estrogen's available. This is where female physical characteristics start to show up when a little girl's ovaries start releasing estrogen. She starts to get curvaceous. She gets breast development because breast tissue is loaded with estrogen receptor sites, same as a little boy. One of the tragedies of this trans sex crap is you start giving a little boy estrogen, he's going to grow breasts. But little boys are fed testosterone from their testicles as they start to age. Muscles strengthen, bones get thicker, and they start turning into a man. Just as the estrogen turns a little girl into a woman. And provided there aren't any kind of chemical interferences, and they have normal ovaries or testicles, they're going to turn into a healthy young woman or a healthy young man. Now, when you start adding these hormones to a body that's already trying to regulate these hormones, and it's a hormone that triggers growth. You are flat out playing with fire. Now, again, because Congress is owned by big food, they're not going to stop estrogen being put into commercial animals. Now, estrogen, if you have your own source of beef, grass pastured beef, there's still going to be estrogen in the meat of that animal. But natural estrogen is destroyed by stomach acids when you eat that meat. Synthetic estrogen goes through the digestive system into the bloodstream. Now, I said all this layered upon what I started off with. A woman who is dealing with breast cancer, who's eating foods that has estrogen in it. And you wonder why the cancer therapy doesn't work. So in the, I saw a chicken leg the other day. It almost looked like a small turkey leg. It was huge. I was in a supermarket getting some things that I need for myself. And as I walked by the hot, in the deli, the hot section area, where the chicken fingers and baked beans and pizzas and fried chicken and everything else, they had a tub of just chicken legs. And I sat there and stared at those things. They're huge. Why are they huge? Because they're Franken chickens. They're the chickens of Frankenstein. Mother Nature didn't make those chickens. Mother Nature's procedures allowed that egg to be fertilized and develop a chick. But the food that those chickens ate thereafter, loaded with estrogenic compounds, made them turn into giant chickens. Now, the food industry puts these artificial estrogens into these foods to increase their rate of growth. And I am told that in the United States of America, all meat and poultry is so heavily contaminated with artificial estrogens that the treatment of cancer of the breast is made far more difficult. Because surgeons, after operating on the breast tissue, often measure a woman's excretion of estrogens in order to decide whether further operations on her ovaries and her suprarenal glands are necessary to prevent her from making any further estrogens. Now, not all female cancers are estrogen dependent, but the more dangerous ones are, because estrogen makes things, fill in the blank, grow. And a lot of times they want to measure the amount of estrogen coming out of an ovary after they've removed a breast to find out if it's going to get in the way of their chemical attack. The post-surgical treatment that you're going to get, the chemotherapy and the radiation. And if your estrogen output from your ovaries is high enough, they're going to talk to you about taking out your ovaries in order for their therapies to work and to prevent any chance of cancer down the road. But the estrogens that she is excreting are not being made by herself. They're only coming from her food. And of course, further operations would not be necessary. So the decision whether or not to operate is not easy in the face of the possible food effect, and it's often wrong. No woman should be eating commercially bred chickens or meat that she knows has been treated with estrogens. Because the older a woman gets post-menopausal, the greater the chance of breast cancer or endometrial cancer being caused by a proliferation of estrogen in the bloodstream. Far more so than in a man. So in defense of the treatment of animals with synthetic estrogens, it has been said firstly that no more estrogen is injected into the animal than it may be making itself. That's the claim. But the natural estrogens, as I said, that are present in the flesh of these animals are destroyed during digestion in the human stomach. While these synthetic estrogens, to repeat myself because it's important, are not destroyed but are absorbed by the body. And where will those estrogens, the synthetic estrogens, do their dirty work? Wherever there's estrogen receptor sites. You don't have estrogen receptor sites on your eyeballs, but you do in the breast, and you do in the lungs, and you do in most of the organs that are involved in the transition of sex from an androgynous little girl to sexual maturation. So that's why you can find estrogenic cancers throughout the body. Now, I said all that to say this: no woman, pre or post or perimenopausal, should be eating commercial foods that contain estrogen. You're playing with fire. Now, it's also claimed that there's been no increase in cancer of the breast since synthetic estrogens were introduced as a medical treatment for menopausal disorders. But such treatment is generally only given for a short time, and further is given when the body's production of estrogens are normally going through a waning phase, so that there is no additive effect of the natural that she's already still making and synthetic hormone. This medicinal use of synthetic estrogens later in life, postmenopausal, is totally different to the regular giving of hormones in food throughout a woman's entire life from infancy onward. It's not the same thing. And for a surgeon who turns out total hysterectomies, 2 or 3 or 4 or 5 a day, at the same way a car dealership might be just turning out 3 or 4 or 5 cars a day, to say that you don't need your ovaries past menopause is an absolute lie. Your ovaries continue to make estrogen, natural estrogen, to keep the softness of that skin, to keep your sex life alive. But fortunately, the estrogen level is low enough that you don't ovulate. So you still have all the womanly characteristics you grew up with. You just don't develop eggs anymore. Thank goodness. But you need that estrogen. Why? Because your organs have estrogen receptor sites that trigger the growth of new tissue. Duh. I was taught all this in school over 3 decades ago. And it hasn't changed. Other cancers besides cancer of the breast are caused by estrogens as well. Leukemia, cancer of the blood. We know that higher levels of estrogen in the bloodstream will lead to leukemia. Can and may lead to, let me clarify that, may lead to leukemia. In animals, elevated estrogens, cancer of the kidney, cancer of the bladder, cancer of the testicles, cancer of the uterus, and then again, leukemia, various forms of leukemia. So estrogen or hormone-treated animals should never, ever be sold for human food. And until they're banned by law, you need to ask the butcher about the meat you're buying and the poultry and refuse any that they think may have come from hormone-treated animals, which is about 80 to 90% of what's in the marketplace. Because ultimately, the prevention of cancer lies in the hands of the individual or the individual's parents. So what are some of the things you might avoid that we know tend to cancer? And this again is being brought to the fore by Bobby Kennedy Jr. Artificially colored foods. What's the first thing he's trying to get rid of? Is the color dyes. The stuff that colors our jams and jellies. The stuff that colors the icings on our cakes and our sweets. The things that color the ingredients of our breakfast cereals, especially for children. But not just children. You got colored dyes in adult breakfast cereals as well. They're just not fuchsia and purple and green. No, they're more brown colored. But they're still artificial. Canned peas. I was reading this. Canned peas contain as much as 3 different layers of green dye to make sure that when you open up that can of green peas that still has a year of shelf life left, but it's 6 months after the canning, and you pour out the peas, they look like peas, which they wouldn't if they weren't dyed. Margarine, butter substitutes that are all colored. Various dessert fillings, custards, creams, in order to get some decorative thing. We know that oranges can often be sprayed with an orange color. Carrots, especially the baby carrots, can be sprayed orange with an orange coloring. You know there's no such thing as a baby carrot, right? That little bag of baby carrots, they were ugly looking carrots that were put onto a lathe. I don't know how they do it. I just imagine somebody putting the ugly looking carrot on a lathe, trimming it down to where it looks like a baby carrot and throwing it in a bag. The emulsifiers that are in foods, the emulsifiers, especially that come with bread products. The hormones in meat, of course, especially poultry. Commercial eggs that have abnormally bright yellow yolks, not the orange yolk, just an abnormally bright yellow yolk. That sucker is loaded with soy. Most commercial eggs come from chickens that have been injected with these chemicals. It ends up in the egg. So what are you going to do? There's only one source of eggs you should be eating if you don't have backyard chickens. And I think there's as many people who stopped having backyard chickens as there were people who started having. But some people do well with backyard chickens. Are the pasture-free, the pasture-raised chickens, not cage-free. Cage-free means they have about twice their body size because they're not in a cage. But they're all crammed into a big warehouse with no sunlight. And what are they fed? Well, they're fed chicken feed. What's one of the primary ingredients of chicken feed? Soy. GMO corn. Does that get into the egg? You bet it gets into the egg. It gets into the egg yolk. But pasture Eggs are expensive. They can be $12 a dozen, $1 an egg. But those are the healthy eggs. There's arsenic still showing up on some apples, which is where polio came from. And detergents. There are actual detergents that have estrogenic compounds in them. Now, artificial fats. We're about time out of the, yeah, because I'm going to get into the heart the second hour, especially atrial fibrillation. A very dangerous thing. But anyway, coloring may not be with the natural and safe carotene. Because a lot of times the marketers, the grocers, will employ the use of carotene as a coloring agent. That's okay, that's fine. Mother Nature made carotene. But these synthetic dyes, again, that Bobby Kennedy Jr. is after, which in theory do not, because we're assured they don't, but through his work at HHS, becoming increasingly apparent, may actually be causing cancer. People who seem to eat more foods that have commercial dyes in them, and most people don't even know they're doing it. They're not aware that they're eating this poison because they usually don't bother to research. They just assume if it has a USDA label on it, or some other kind of label from some food monitoring group, that it's okay, but you have to go back to the ultimate source of this stuff. And so you remember the story of Napoleon and the bread that he was getting with his soldiers moving towards Moscow. And there wasn't enough butter to go around with 200,000 or 300,000 soldiers. So his chemists got to work coming up with an alternative. And that was the beginning of margarine, for which these guys got very sick. Because the heating of an oil that's in the seed oils that are used in the producing of artificial butter, margarines, are high enough to cause cancer-causing substances. Another thing that Bobby Kennedy's going after. And the essential fatty acids that are absolutely essential for brain health are destroyed and changed into toxic, abnormal fatty acids that have an anti-essential fatty acid effect on the brain, which some assertions now are pointing to one of the causes of Alzheimer's, is a heavy consumption of these seed oils. Now, essential fatty acids are essential both for many of the physical structures of the body and for the biochemical processes of the body, which is one reason why they were given the original title of vitamin F. For their proper functioning, you need vitamin B6 and vitamin E, both of which are destroyed in the milling of flour. Though could be one of your best sources if you're making your bread from fresh ground whole wheat. But a simple deficiency of essential fatty acids, such as could be brought about by a diet centered, as many of them are, around flour and artificial fats, is thought to be at least a contributory cause to neurological diseases, to cancer, heart disease, arteriosclerosis, and various degenerative conditions, not the least of which is senility, cataracts, tooth decay, osteoporosis. All these things have been implicated with their possible effect from these artificial foods. Now, I don't want to sound like I'm preaching, but ever since my introduction to nutritional healing in my very early 20s, so that's over 50 years ago, one thing has remained absolutely concrete all the way through. And that is, I believe, 90% of the suffering of mankind is simply because of malnutrition. Not mankind, Americans. For malnutrition. Malnutrition from not getting what you need, and malnutrition getting too much of what you don't need. But either one ends up in the body not getting the micronutrition that it needs. That's why I've created the JAX packs, along with my staff. For men, hormonal support. For women's hormonal support. The most popular one, of course, is for the heart. For the immune system, for children's immune system, and several other of these JAX packs. They put together 2 or 3, maybe 4 supplements that will absolutely turn those problems around in a matter of 60 to 90 days, just by feeding the body what it needs. Now, I'm going to get into the heart. I want to spend more time on the heart because, as I said, another person I know in their 50s just died of a heart attack. Not a patient, just somebody I'm aware of. And that's too early. All I heard was 50s. Even late 50s is too early to be dying of a heart attack. When I take my morning supplements, and I take a lot of them, I mean, that's my breakfast. I take them for my heart. I'm taking them for my liver, for my kidneys. I'm taking them for my brain. I'm taking them for my adrenals, my thyroid. What else? My immune system. So that ends up being a lot of pills. Well, Dr. Jack, do we have to take all those pills? No. The standard answer, of course, is eat better. Now, I picked up a 1-pound package of hamburger from Harmon's the other day that also has heart and liver in it. I thought, wow, somebody got a clue out there. I haven't cooked it up yet. I'll probably cook it up this weekend. What am I going to make out of it? I don't know. I got some really good homemade marinara sauce. Might just make that and put it over a salad or vegetables. No pasta. I could spend some time on that, but I'm not. I'm afraid I might be getting boring here, so I want to move on. I want to talk about the FDA reporting on these COVID shots that killed 10 children, and now they're vowing new vaccine rules. I think that this may well be just the tip of the iceberg. As Dr. McCullough was saying the other day on a broadcast, this admission, arriving years late, mind you, and delivered through a leak rather than a public press conference, appears to function as some kind of a limited disclosure attempt designed to try to bury the true magnitude of harm. And what McCullough was referring to is the idea that coming out and saying, with all the research we've done, it looks like 10 children might have died from the COVID shot. When in fact it's scores, scales way beyond that. But when they come out and admit that 10 of them, it was an attempt to bury the true magnitude of the harm that was given to children all across this country. And 10 deaths is just the microscopic tip of the iceberg. And that iceberg is massive. Some of the peer-reviewed science already documented scores of autopsy-confirmed mRNA deaths. I don't have time to go into all of this, but you can find it out for yourself through the McCullough Foundation. And their autopsy papers that's been ignored by federal regulators document far more than 10 deaths. So far, what they've been able to do is to identify hundreds of confirmed vaccine deaths already documented, 240 confirmed COVID-19 vaccine deaths via the multi-organ systems. 28 confirmed COVID-19 vaccine myocarditis deaths. But through May of 2025, from the beginning of this whole COVID nonsense, up through May of this year, VAERS documents 19,355 deaths from the COVID vaccine. And remember the number, the percentage of reports on VAERS as opposed to the unreported? It was 100 to 1. There's been more than one peer-reviewed review of the VAERS system saying that it's probably 100 to 1 diminution of the true numbers for cover-up reasons. In other words, instead of 19,355, it would be 190,355. And that system has been known to underreport, as I said, as much as 100 plus. So using conservative assumptions, this could be as high as 600,000 American deaths, more than World War I, World War II, and Vietnam combined. There was another independent COVID-19 vaccine toll estimation based on a study headed by Professor Retief Levy and Florida Surgeon General Joseph Ladapo, you know him. And it was titled 12-Month All-Cause Mortality After Initial COVID-19 Vaccine, which was the Pfizer one, among adults living in Florida. And it yielded a very highly conservative estimate of 470,000 American deaths from the Pfizer vaccine. So when they come out and you hear these news reports, maybe as many as 10 children were killed. It's BS of the highest magnitude. And then when it gets on the Joe Rogan show, and Joe Rogan starts talking about it, then a lot of people start finding out about it. I can go into that a little bit further, but I want to get to the heart. But you can go Google that. You go Google the 10 children dying from the COVID vaccine and come up with a lot of interesting numbers yourself without having to look too far. All right, I want to get to the heart. The heart is because it's the number one killer in America. Cancer close behind. I think a lot of what I said this morning about cancer and the estrogenic foods, I would also blame the massive occurrence of heart disease on foods. There isn't a day that goes by that I'm taking care of patients for a variety of reasons that there isn't at least 2 or 3 that ask me questions about their heart. And it's kind of like they've started to develop a little chest pain or a little bit of pain in their arm or some pain in their chest that wakes them up in the middle of the night. And for the first time in their life, they're actually giving some thought to some organ dysfunction because it's getting in the way of their lifestyle. And unfortunately, that's the case with many of us. Until something begins to be a big enough problem that it gets in the way of our lifestyle, we don't pay a lot of attention to it. How's that old saying go? When the pain until the pain of doing something about the problem is greater than the pain of the problem. Nothing's going to change. I just murdered that, but it's something like that, which I always thought made a lot of sense. Now, atrial fibrillation is a particular type of cardiac arrhythmia or some irregular heartbeat that's becoming epidemic in this country. And a lot of people live normal lives with this condition, while others can easily end up with uncontrolled soaring heart rates up to 250 beats a minute. Now, the drugs and the pacemakers are the main therapies for atrial fibrillation, though they are often unsuccessful or can carry serious side effects. But for some people, chronic atrial fibrillation can lead to a heart attack, stroke, or even congenital heart failure. Now, when the heart is going through its normal contractile cycle, lub-dub, 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 two things are taking place. The muscle is pumping blood, either to the body or to the lungs. And at the same time, in that beat, there's a closing of valves so that the blood moves in the direction it's supposed to move, so that it doesn't go backwards. It just goes forward. And fibrillation is where the heart kind of just goes into this quivering mode. It doesn't do lub-dub, lub-dub. Because you can see it. You can see it both on an EKG, and you can see it on the heart sound recorder that we use in the office, where the heart is just fluttering. And unless the ventricles, the big pumping power at the bottom of your heart, the bottom half, the left ventricle pumping blood into the aorta, the right ventricle pumping deoxygenated blood into the lungs to pick up oxygen, they need those chambers full of blood in order to pump it to the body. And what happens in fibrillation is the atrium, the two little pumps that are sitting on top of the ventricles, the top half of the heart. The left one is getting oxygenated blood from the lungs, and it needs to pump its full amount into the left ventricle, so the left ventricle can pump that blood into the aorta, to the brain and the rest of the body. And the right atrium is receiving deoxygenated blood through the inferior and superior vena cava, bringing dark oxygen poor blood into the right atrium that's going to pump it down into the right ventricle. So the right ventricle, being a bigger, stronger muscle, can pump that blood into the lungs. Now, you remember using a hand pump at a well? Trying to think of an analogy here for you that might make sense. When you push that arm down and water is coming out of that pump, it's because the pressure you're creating is greater than the resistance of that water sitting in the well. And by that strong pump, water comes flowing out. Now imagine that well getting low enough that every time you pump that thing, it was sucking air as well as water. And all of a sudden, you're just not getting the water coming through that you want. When you have atrial fibrillation, the left and the right atrium are sitting there kind of quivering instead of pumping. There's no lub-dub, lub-dub. There's little going on. And so the ventricles waiting to get their full complement of blood to pump it to the body isn't getting it. It's getting a very weak amount of blood. What's that going to lead to? Well, simply, the brain and organs are going to be starved of oxygen because they're not getting what they are sitting there waiting for, a good complement of oxygenated blood. It's one of the side effects of a bad heart attack. Someone has a bad heart attack either because through the atrium or through the ventricles, whatever. The myocardium is robbed of oxygen, goes into a stroke, or full-blown heart attack, and it can't pump blood. And then we always wonder about how long did this go on, because was the brain affected by not getting enough oxygenated blood by this? But what about the heart itself? The heart's the first one to get the blood. The liver, the kidneys, the ovaries, the thyroid. All of these organs being robbed of oxygen, not just the brain, when these kinds of things are going on, because it can lead to anything. Now, what causes atrial fibrillation is a condition where there are conflicting electrical signals to the heart muscle. Now, the heart is 99% muscle and valve. It's 1% pacemaker cells. Those pacemaker cells are sitting at the very top at the ventricle. Is it the sino or the atrial? Sino-atrial? The SA or I think it's at the SV node is where the pacemaker cells are. And they're generating an electrical signal, just like in an electric eel. And that signal goes down through the middle of the heart, causing the atrium and the ventricles to beat on a regular rhythm. Now, the heart also has nerve supply through the parasympathetic and sympathetic autonomic system to have an electrical slowdown or an electrical speed up of the heart. The heart's also influenced by hormones coming out of the adrenals that will regulate pressure as well as heart rate. So there's several things causing a regular beat to the heart to take place. Now, when you start getting these crazy beats, it's because of conflicting electrical signals. And this causes the heart's two upper chambers, the atrium, to quiver and simply fibrillate rather than pump into a timely, functional manner of an amount of blood both the ventricles need to get it to the body. And this is obviously, it reduces the heart's ability to pump blood into circulation, and this weakness causes the heart to beat more quickly. So as soon as the fibrillation is taking place, you're not getting enough blood going to the pumping chambers of the heart, and the brain is sitting up there waiting for its oxygen, and it's not getting what it needs. It sends a signal down through the adrenals to release a hormone that speeds the heart up, but also through the sympathetic chain in the spine to make the heart beat faster. Then you start getting extremely high heart rate. And the fluttering just gets worse because the cause of the fibrillation hasn't been addressed, but the emergency procedures that your body employs to get that vital oxygen into the brain is making the heart beat even faster, even though it's not pumping efficiently. And so, while medically speaking, the cause of atrial fibrillation is often unknown, we know that it is the most often caused by nutritional deficiencies or nutritional imbalances. The electrical signaling device is not getting the micronutrition it needs. The walls of the atrium and the muscular part of it is not getting the food it needs to get its job done. And so when directly caused by nutritional deficiencies or imbalances, the application of proper nutritional protocols can promptly correct the problem, as we have seen more times than I can count this morning with patients of the clinic that we did a heart sound recorder on that have a history of atrial fibrillation. So we do the scan, and we can, here it is, right, going across the screen. It should be lub dub, and it's lub blah 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 blah. The heart is not relaxing at all. It's constantly pumping. Pumping because it has aberrant electrical signals, and pumping harder and faster because the brain is telling it to. Like kicking a dying horse. Now, how do we know that there's a nutritional component? Because we have our patients chew up a few supplements. Wait about 20, 25 minutes and then retest. And you see an immediate improvement on the screen, on the computer screen, in heart function, that fast. No organ responds to improved nutrition faster than the heart does. So when I found this ground beef, 85-15, I prefer 80-20, but it was 85-15 breakdown between meat and fat, but also has ground up heart and ground up liver in it. Gee whiz, somebody's got a brain out there. So there was only one left. I bought it. As I said, I haven't cooked it yet. But there are other causes. There's thyroid problems, an aging neuromuscular firing system in the heart, an enlarged heart, long-term high blood pressure can be causing this. There's a lot of different cases, but in most cases, almost all direct and indirect causes stem from nutritional imbalance, or nutritional deficiencies, and chemical imbalances. And what do we do about it? Well, we throw drugs at it. We throw the drugs to force the heart to do this or that, to improve from what it's already doing, based on the fact that it's starving to death. It's that simple. Now, most people will recognize an abnormal pulse. You can, put your fingers there on the radial artery, the inside of your wrist, just, on the arm side of the wrist, and feel. And when in these states, when you have an abnormal beat, which we also see on the heart sound recorder, there can be fatigue, chest pain, sweating, dizziness, shortness of breath. And then there are legions of people with atrial fibrillation who experience essentially no symptoms at all. They never knew that they had it until they see the fibrillation pattern on an EKG or through the heart sound recorder. And so what do they do about it? What's the standard medical approach? Because if this is left untreated, you can throw a clot. That fibrillation causes turbulence. Turbulence can slow down things. If you look at if you're a fisherman or you've been floating in floats or canoes or something on these river streams that Utah is full of, and if you are above the rock level, there's enough, spring runoff, the water is deep, and you're on a canoe or whatever, and you're just floating right on down the stream without interference. But when the water through the summer season gets lower and lower, and rocks begin to be exposed, then you start to see turbulence. In other words, a disruption of the flow of the water. And especially a bigger rock that ends up, as the river is flowing down around the rock, on the backside of the rock is a calm water. There's a pool of calm, a place where you like to drop a fly when you're fly fishing. But all around it, it's turbulent, but that one spot is calming down. This actually pulls up like this inside the atrium of the heart when it's fibrillating. What does that mean? That means the blood can go into a stasis period where it's not moving. And one of the things that keeps blood from clotting outside of the normal clotting procedure when clotting is triggered from bleeding is the movement of the blood itself. And when the blood stops moving, as will happen in the atrium during fibrillation in certain places, you can form a clot. And it'll get into the body. And if it bypasses the brain, thank goodness, it could end up somewhere else in the body, causing all kinds of problems. And so medical treatments are somewhat limited and often debilitating when they're dealing with atrial fibrillation. And ablation is a favorite treatment where some nerve sites in the heart are destroyed with high frequency sound that's delivered through a catheter. And the cardiac conversion is another favorite where cardiologists attempt to shock the heart into a normal rhythm. Neither are proven successful or long-lasting. And with either one, powerful drugs also are prescribed along with it, not the least of which is warfarin or Eliquis, blood thinners. An ablation is where they will put this catheter into the heart and put it down into the ventricles or into the atrium where the nerve centers are that initiate the contraction and burn them, burn the nerves so that the normal cardiac trigger for atrial fibrillation stops because you stop the signal. Again, you're driving down the highway and your check engine light comes on. And you got a pair of cutters or dikes. You reach up underneath the dashboard and cut the wire that's lighting up the check engine light. Now, warfarin or Coumadin, and there are doctors who still use Coumadin because there's no antidote for Eliquis, which is why when you get on Eliquis, they tell you very clearly, don't bleed. Aspirin, there's other cardiac measures that can be taken. In severe cases, a pacemaker is implanted to control the heartbeat. And in the end, the medical treatment chosen kind of should be the most effective treatment with the least amount of toxicity. Unfortunately, this is a tough task, and the results are not always good. So what do? We're not heart doctors. I'm not a cardiologist. But I'll hold my own against any cardiologist if they want to talk about our approach to feeding the heart to get it to work better. But the only way to eliminate atrial fibrillation is to correct the cause of the problem, if it is at all correctable. And in some instances of severe valvular disease or deteriorated blood vessel disease, the condition can only be managed. However, every attempt should be made to use natural therapies in an effort to protect, from both the potential damage from atrial fibrillation and the side effects of standard medical treatments. So a large percentage of patients can control and correct atrial fibrillation, as we have done with many of our patients, with nutritional protocols, where we feed the heart what it needs to operate correctly. And while each person is different, and we evaluate our patients like this differently, the goal is that an atrial fibrillation nutritional protocol, what we're trying to accomplish, better nerve stimulation of the heart, increased tone and strength of the heart muscle, more proper elasticity through the circulatory tree, the blood vessels, and a natural viscosity of the blood, thinning it naturally. And at the same time, we also, if we're going to help somebody with the heart, we need labs. And along with the labs that indicate heart function, we need thyroid labs as well, because the thyroid can have a big effect on these kinds of things. And then food-wise, caffeine, alcohol, fried foods, processed foods, too much sugar, soft drinks, margarine, other stimulating drugs like over-the-counters stuff should have got to be looked at closely, because it can contribute to fibrillation as well. Now, over the years, and I've been around a little while, I've learned that the best protocol for atrial fibrillation is an individualized one, just like this lady I mentioned at the beginning of the show, talking to her about her endometrial cancer. We had some things to recommend. And we sent this off to her. Well, we have some protocols that we recommend for the heart. It's in Jack's pack. It's in the heart pack. Cardio Plus, 3 to 4 of them, taken 3 times a day. Cataplex B Core, 2 of them taken 3 times a day. Cataplex B2, which is 2 of them taken 3 times a day. And if the heartbeat is, if it's only too fast, then that's a good protocol to follow. Cardio Plus, the Cataplex B4, and the Cataplex B2. Now, if there's other stuff going on, we want to bring in calcium or Cataplex F as a bit of a relaxer. Calcium lactate. Your heart will not beat without a sufficient amount of calcium, which is why one of the drugs several drugs in the marketplace that they use to deal with high blood pressure are calcium channel blockers. It stops the calcium effect upon the beating heart, which is almost enough to stop the heart from beating. And then there are other things we like, magnesium lactate, if we're dealing with problems with stenosis or regurgitation. But once the right protocol for atrial fibrillation will slowly start to disappear. We've seen this in our patients. And there we have on display in the office an EKG of a fellow who came in, showed me the EKG, just all the line. There's no resting period for the heart. It's just constant noise. And we put him on a protocol, and he came back about 5 weeks later, a little over a month, with normal heart rate. A little bit, it was still too rapid. The heart rate was still too high, but the fibrillation was gone in just 1 month. So, what causes heart arrhythmia? I think maybe I should have started off with that. We got about a half an hour. There are different kinds of arrhythmias. Tachycardia, rapid heartbeat, is an arrhythmia. Bradycardia, where it slows down. Atrial fibrillation, PVUs, preventricular contractions, PVCs, not PVUs. It's where the ventricle is starting to contract when it shouldn't. What else? There's a bunch of them. And the number of patients with these heartbeat abnormalities is increasing all the time. And the typical treatment is Lanoxin or metoprolol, warfare, Coumadin, because of the possibility of clot formation in a fibrillating atrium. And most cases of arrhythmia originate from a nutritional deficiency involving the B vitamins. And these cases are simply induced by pharmaceutical drugs, blood pressure drugs are some of the main culprits. You start taking drugs for the heart kind of has this kickback reaction to it, which leads to fibrillation. And still there are these cases that do not fall into any of these categories. But the cause of the arrhythmia is some people, it can go undiagnosed for a lifetime. However, if you suffer from a tough case that does not fit in the usual categories, you would probably do really well to consider the secret cause of heart problems that I want to talk about here. And by secret, you're not going to hear it from your cardiologist. Naturally, I would think, before chasing after the less common causes of arrhythmias and fibrillation, you have to eliminate the more common causes. And as I've been talking about here, it includes drugs, nutritional deficiencies, chronic stress, the overuse of stimulants like caffeine, a lot of these herbal uppers. You know which ones. You know, you gotta drive down to St. George, and you just got home from work, and you got an emergency. You got to get to St. George, and you load up with some of this stuff. The super high caffeine guarana included drinks. These can lead to arrhythmias. Now, the use of 4 products, as I was mentioning earlier, will eliminate the nutritional deficiencies and imbalances that cause most heart arrhythmias. You might want to write this down, but they're in Jack's pack for heart support. Cardio Plus, which is food for the heart, anywhere from 6 to as many as 15 a day, 5, 5, and 5. Cataplex B Core, anywhere from 6 to 9 a day. It has the important vitamin B4 in it. Organically bound minerals can slow down a heart. And the 4th product is just cod liver oil. Now, you have to give yourself anywhere from 3 to 6 months on this protocol to evaluate the nutrition alone, if it's nutrition alone that's causing the fibrillation, because your heart has to rebuild itself. But these supplements I'm mentioning, the Cardio Plus, the Cataplex B Core, the organically bound minerals, and the cod liver oil, have all the raw materials that the heart needs to operate not only in optimum function, but to operate, period, because the food for good heart stimulation and heart function is missing in our diets. Now, after 3 months on the protocol, you can go back to the cardiologist and have them start to wean you off of the blood pressure drugs that you're on. Now, the 4 products that comprise this basic heart arrhythmia protocol will normalize any B vitamin imbalances and provide vitamin E as well. The essential fatty acids, the rest of the B component, the rest of the B family, excuse me, coenzyme Q10, vitamin C, organic minerals, heart protomorphogens, and hundreds of thousands of other nutrients, both known and unknown, including enzymes, coenzymes, trace minerals, and a lot more. And it's interesting that I remember the first time reading in Dr. Royal Lee's notes, where he said, when we were making Catalin, we put in this, and this, and this, and this, and this. And he said, towards the end of it, because I think there's over 20 ingredients. He said it may well be the unknown factors in our food that we've not discovered yet that may be the reason why a return to good, wholesome foods from Mother Nature can change a person's overall health profile almost overnight. Now, during this time, you don't want to be taking these high-potency synthetic nutrients, especially true of a high-potency B vitamin. And it's a little-known fact that these products can induce powerful nutritional deficiencies and imbalances which can initiate cardiac arrhythmias. I have personal experience with liquid minerals, the ionic stuff that comes out of the Great Salt Lake, and using them because they didn't go through food, and I'm not going to mention the brand or anything else, because they didn't go through food before it got to my body. They came straight into my body in a liquid oral fashion. It led to a lot of deficiencies that ended up producing a mouthful of cancer, sores, muscle aches and pains, and cardiac arrhythmias, because they led to tremendous electrical imbalances. So most arrhythmias will slowly disappear on the nutritional protocol I just gave you. Cardio Plus, Cataplex B4, organically bound minerals, and cod liver oil. Now, there is a book out there called the Physician's Drug Reference Handbook. You can buy one of these in a bookstore and just look up the prescription drug you're taking and look for the side effects. Now, some other causes. Because when you think about it, the cause of all heart arrhythmia problems is an abnormal nerve stimulation or muscle reaction to nerve stimulation of the heart. And you want to consider what would cause the small nerve impulse flow to the heart to become erratic. And the nutritional deficiencies and drug side effects that I've been talking about here are the main causes. But there's other factors which can also produce this phenomenon, one of which is adrenaline. This hormone that comes out of your adrenal glands. An overabundance of adrenaline. I mean, when you're frightened, the fight or flight response, your body excretes adrenaline and your heart begins to beat very fast because it may be incumbent upon you to run for your life. So even before there's a physical demand, your central nervous system has already said, okay, here we are, we're coming for the ride. And when your heart gets beating this super fast, if this is going on chronically because of a high stress life, it doesn't matter which direction you turn, there's stressful moments. The cortisol is always high. It interrupts your sleep at night. You have a hard time calming down. And you notice you've got a continually high heart rate. That can lead to these arrhythmias. And the most common causes of adrenal imbalances are drugs and the nutritional deficiencies that I just mentioned. But the use of drugs. Whenever if you've got a kidney problem and they give you a drug to improve your flow rate, if you got a thyroid problem and they give you a drug to improve the conversion between T4 to T3, or some other kind of deficiency going on, if these continue unabated, eventually you could throw a clot, but it's just that arrhythmia that never gets a chance to calm down. Now, if you're consuming too many carbohydrates, breads, pasta, processed foods. That can induce a chronic adrenal problem with too much adrenaline circulating in the blood, and actually caused by too much insulin that's produced by the body to counter the excessive carbohydrate intake that you're doing. But in all cases of stubborn arrhythmias, a low carbohydrate diet should always be instituted for at least a month. Something keto, something Atkinsy. You don't have to go full carnivore, but you just need to drop from your diet the very common non-food items that make up our diet. Some of these mac and cheese things, or too many stopping and picking up takeout from evening meals way too much. The seed oils, the preservatives, the things I talked about the first hour of this show, all tend to lead us back to a good, well-made, home-cooked meal, where the TVs are turned off and the cell phones are left in another room, and we sit around the table as a family and calm down and review the day. That has a tremendous effect on calming the heart and lowering adrenaline levels. So there is a product called Drenamin that feeds the adrenals, because a lot of this extra adrenal activity is, again, from malnutrition. I mean, when's the last time you ate adrenal glands? Back on the old frontier with our pioneers, they ate everything. One of the most delicious things that they ate that's written in their anthologies is oxtail soup. But they'd eat everything, including the thyroid, the thymus, the brains, the adrenals. Your adrenals are one of the greatest sources of concentrated vitamin C in the body. And when Dr. Price was out visiting different ethnic groups around the planet back in the 1930s, several of them, when they would process an animal, would take the adrenal glands and feed them to any of the women who were pregnant in the community at the time, because it was a tremendous source of adrenal hormones in a balanced state, but also because of the extremely high vitamin C content, which in some cases in the middle of winter was hard to come by. So Drenamin is practically half vitamin C. And then, I don't know if I want to call it a secret, but a second secret cause of arrhythmias is kind of a variation on the first one. It's hormonal imbalances, because most functions in the body are governed in one respect or another by hormones. And any heartbeat is a part of this biochemistry. So if you're a long-term arrhythmia sufferer and you take hormones of any type, including birth control pills, you want to maybe see your doctor to try a 3-month test stretch without hormones. And in addition, you can help normalize hormones by taking a hormone protomorphogen that we recommend to people in this condition. Simplex F for women, Simplex M for men. It could be a pinched nerve that's causing these arrhythmias, because that actually will interfere with the nerve flow to the heart muscle. These nerves are part of the autonomic nervous system, as I was saying earlier, the parasympathetic, the rest and digest influence that slows things down. And then you have the sympathetic, fight or flight, that speeds things up. And if there's some disturbance in these nerves, it can easily speed the heart up, slow the heart down, or cause erratic up and down speeds. That's where I think the work that I do, working with nerve centers, plexuses, where they have their root in the spinal cord, sending their signals out through these, from the spinal vertebra into the various parts of the body, not the least of which is the heart. Interference in this area can cause a chronic irritation to the nerves that make up the centers that feed out to the heart. And it's not unheard of at all in my clinic, where a good spinal correction can cure an arrhythmia just by the power of the adjustment. So I think resolving some tough cases of heart arrhythmia requires rather difficult detective work. So we use the heart sound recorder. We use Ragland's test. We use a few other things to pinpoint where the weakness of the heart is allowing these symptoms to appear. So when we're dealing with a patient with arrhythmias, I have to know the drugs. What drugs are you taking now? What dosage? Do you ever skip them? Are you pretty religious about it? Because we're not going to interfere with that. We're not going to interfere with what your cardiologist has to say. We're not going to interfere whatsoever with what your heart doctor has you on. It may well be that you're alive because of these drugs your physician has prescribed. We're not doing anything with that. What we're going to do is give you some food-based supplementation, and you can just read the label on the bottle so you know what I mean by food-based. To feed that heart to regain some of its strength and power and efficiency due to proper feeding, by giving the heart the vital micronutrition that it needs. And since the number of prescriptions is constantly growing, and in some cases, for the individual patient, the amount is increasing, I see that these problems are simply getting worse. As prescriptions proliferate, there's going to be more and more powerful people with heartbeats that simply will not quiet down, and these powerful people will continue to use powerful drugs when you're just trying to treat a heart that is currently starving. That's all. And I find that's the case with a lot of other organs in the body: the liver, the ovaries, the testicles, the thyroid. If they're not getting the vital nutrition that Mother Nature designed for them in the first place, they simply are not going to work well. Now, I have a lot of patients I take care of that are gym rats. I think that's a cute word. Gym rats. I mean, they're in the gym every day for 2 or 3, maybe 4 hours. A couple hours before work, a couple hours after work, or 4 hours all at one time. And their bodies the tone is really good. They got good muscle development. The muscles are strong. Every month or two that goes by, they're increasing weight to the resistance. And resistance exercise is wonderful exercise for the heart. There's no issue about it. It may, in some cases, maybe even better than cardio. But interestingly enough, when we do a heart sound recorder on these people, the hearts look terrible. They look terrible because they're not being fed the micronutrition that they should be getting. The Cardio Plus, the Cataplex B Core, the Cataplex B2, just those 3 things right there, let alone the other stuff I'm talking about, will put the food back into the heart that the heart is designed to consume, as opposed to the drugs that come and force the body to do something. And they're certainly not food. But as I said earlier, in some cases, that's what's keeping some people alive. So we don't play with that. The heart sound recorder It's just a little microphone. It's called auscultation. To this day, if you research auscultation, auscultation, that's the stethoscope. Auscultation is to listen by sound. And if you do some research on that, you will find some of the most important clinical centers of the world. Cleveland Clinic, Mayo Clinic. There's one in New York that's names escape me at the moment. That will tell you the definitive methodology to determine heart function is through auscultation, is to listen to the heart. All the other kinds of tests, the labs that focus on heart enzymes, the EKG, these kinds of things give us a picture. But it's not until you've got that stethoscope on and you're listening to the heart, to missed beats, to extra beats, to weakened beats, whatever you're listening to, that is the bottom line way of determining heart function. That's what this heart sound recorder does. It's a microphone. It sits over top of the 4 valves of the heart. We start with the mitral, then we go to the tricuspid, then to the aortic, and then over to the pulmonic valves, because we want to hear how they're working. Are they leaking? Are they working too hard? These kinds of things. And then we make an appropriate protocol. And when the patient says, well, should I tell my MD about this? Well, tell him whatever you want to tell him. I'll be glad to talk to him. I'll tell him why we're not giving you drugs, we're giving you food instead. This is a reason, I think, why Bobby Kennedy Jr. said he's going to start a policy that if medical schools don't start teaching nutrition, they're going to lose NIH funding. And boy, there's no quicker way I know of to get somebody's attention than to shut down the gravy train. But I don't know that that's the best approach, but I think it would get attention. All right, now, the heart sound recorder takes about a half an hour. Actually, the test is over in a matter of minutes. But we talk. We give some instruction, explain a few things, show you the scan and what the scan means. But it's got to be, you can't just walk in and do it. It's got to be scheduled. You call the clinic 801-523-1890. 801-523-1890. Plan on a half an hour. Wear thin clothing, because we'll be able to put the microphone right over the valves. And for bras, don't wear an underwire. That metal can act as an antenna for vibration. So don't be wearing an underwire bra. And in a matter of minutes, we can give you a great indication of what's going on that will act as a baseline. And then we give you a protocol, and then retest you in about 60 to 90 days. And I guarantee you will see a change in your heart scan once you feed it. But not just a change in the heart scan. The better brain function, less lightheadedness, more cognitive concentrating power, these kinds of things. Once the brain is getting a better dose of blood than it otherwise would have been doing had you remained in that state. Now, one more thing about the structural end that I do, the upper cervical work to the spine. It's at half price right now. It's half price through the end of the month. Probably won't do it again until next year. But it's a great way to bring that nervous system back into balance. People come in because of sciatic pain or headaches, migraines. They come in because of stiffness, knee joint problems, shoulder problems. They come in for any of assortment of various pains throughout the body. And as we go through the consultation, I try to explain to him there's something more insidious going on in your body and your central nervous system than just the fact that you've got pain showing up in your shoulder or your neck or your knee or your hip or your groin or that little pain right underneath your right shoulder blade. What's going on is the full energy of the brain to the cells of the body is being limited because of some compression somewhere in that central nervous system that's preventing proper nerve stimulation to take place. Not the least of which could be heart stimulation. So that's the object of what I'm trying to do, is to restore that structural integrity that allows full communication of the brain to the rest of the cells of the body. Which is why, after I've worked on most people, they have this immediate sense that their body is different. It feels different. They're standing different. They're walking differently. They can tell that something has just happened. And then I tell them, well, over the next 3, 4, 5 weeks, you're going to notice notice that you are different. Your immune system is online now. And that central nervous system finally is getting the signals through. Signals to the brain, signals from the brain. So all of this kind of boils down to a real simple kind of application. If you just feed the body what it requires for optimum performance, you don't have to worry about anything. Well, Dr. Jack, those foods are expensive. Well, you don't need as much. That's one thing we've learned. When you feed the body the micronutrition it requires, it's not that hungry. Then it's just a matter of calories in, calories out. Once you hit that basic supply of energy to the heart. All right, we're coming to an end. And it's not just the heart, it's the liver, it's the kidney, it's the ovaries, it's the brain, everything else. But it starts with the heart, because the heart is the organ in the body that responds to improved nutrition faster than any other organ, though the rest of them will. All right, we're coming to an end here, and I think I'm going to go ahead and close down the stream. Stephen, thank you for your comment that came in an hour ago. I really appreciate that. If you can like and subscribe, it helps the arrhythmias. It helps the analytics. It's my pleasure to do this. I hope I haven't bored you too badly about it. But these are the things you're not going to hear from your cardiologist. Why? Because they have no training in this. They have absolutely no training. It's left out of their education for good reason. Gets in the way of selling drugs. All right, to the stream. I will see you all Monday for an update. Boy, there's going to be some interesting things happening today and tomorrow that we will talk about when I see you guys on Monday.